Hello guys, so now we shall be discussing regarding the nasal conchae, which are also called as the turbinates, nasal turbinates. Nasal conchae are also called as the turbinates. So nasal conchae are also called as the turbinates. So if you do a coronal section, right, this is how you see. So this part is called as your orbit, right? Here also you have got your orbit. Okay, and in the center whatever sinuses you can see, these are called as a paranasal sinuses, right? And apart from these paranasal sinuses, where are these paranasal sinuses located? So these are your paranasal sinuses, right? But in the center, if you see, you can very clearly look at some gaps like this, right? So these gaps are nothing but called as your turbinates. Much more clear image we can look here. You see, this is your orbit. This is your orbit over here. Now we are mainly focusing on this center part. Okay, we mainly focus on this central region here. Okay, exactly in the center here, exactly in the center. So what are the contents of this central region which you can see? So regarding the contents of this central region, first important thing. So the first important thing which you can see over here, right? So this is called as your superior concha. Superior concha. Then which one is called as the inferior concha? See, this one over here is called as your inferior concha. Inferior concha. Okay, concha is also called as turbinate. I can call it as superior concha or superior turbinate. Next, down here you see this one over here. This is called as inferior concha, and the previous one is called as a middle concha. Okay, I'm sorry. This one is called as the middle concha, and this is called as the inferior concha. Inferior concha. Okay. Now, if you look very clearly between the superior concha and the middle concha, see here, between the superior and middle concha you see some space like this. Next, between the middle and inferior concha also you see some space. Next, between the inferior concha and what is this? What is written over here? You see, what is the thing that is written? A hard palate. So between the hard palate and the inferior concha also you see a gap, a cavity like thing. This open cavity like thing which is located in between this concha or turbinates is called as meatus. Okay. So what are the three meatus which we basically have? See, if you look here, this particular meatus which you have over here is called as superior nasal meatus. So this is called as superior nasal meatus. Superior nasal meatus. Next, this particular meatus which you have over here, this one over here you call it as middle meatus or middle nasal meatus. Simply write it as middle meatus. And in the same way, the last one over here, this one you call it as, what is this? This is called as the inferior meatus. So there are three meatus over here. One is called as the superior nasal meatus, middle nasal meatus and inferior nasal meatus, right? Now, in the form of a text, by the picture you understood, okay, but textually how we can write those things so that it would be useful for your notes purpose, okay? So let me write it down. What I am telling is that first let us write about the inferior meatus. Now look at the inferior meatus and tell me where is this inferior meatus located? Inferior meatus is located between inferior concha as well as the hard palate, right? So it is located between inferior concha and the hard palate. Inferior concha as well as the hard palate of your nasal cavity. Next, when it comes to the middle meatus, so where is this middle meatus located? This middle meatus is exactly located between the middle concha as well as the inferior concha. Located between middle concha and inferior concha. Okay. After that, if you look at the superior meatus, where it is located between the superior concha and the middle concha. Where is the superior meatus located? located between superior concha and middle concha. So it is located between the superior as well as the middle concha, right? Now, next important thing which you need to know is that which sinus is draining into these meatus. So in this, how can you differentiate the meatus? See, this line which I am drawing, this gap which I am drawing, right? This is called as the superior meatus. Superior meatus. See, this gap, whatever I am drawing, this is called as the middle meatus, and this lower gap which I am drawing over here, this is called as your inferior meatus. So, superior meatus, middle meatus and inferior meatus. Now, what I am telling you is that, you know, regarding the paranasal sinuses, we have discussed in detail. Before you watch this video, I want you to watch paranasal sinuses so that you will understand completely. We discussed in paranasal sinuses, there is some sinus called frontal sinus. Okay. We also discussed there is a sinus called as maxillary sinus. We discussed a sinus called as anterior ethmoid sinus. Anterior ethmoid sinus. So we discussed three important sinus: frontal sinus, maxillary sinus, anterior ethmoid sinus. Now all these sinuses, you know where they will drain? They will drain into your middle meatus. They will drain into your middle meatus. Okay, so this is one important MCQ which you need to know. Apart from that, I have already drawn a picture of this. Let us see in particular detail of what structures are draining into what meatus. You know this thing that, see, this one is called as superior meatus, this is called middle meatus, this is called as inferior meatus, right? So you know these three things. Next, this one is called superior concha, middle concha and inferior concha. Okay, these are the things you should know. Now what I am telling you is that if you look middle concha, below the middle concha, what do you have? Which meatus you have got? Which meatus do you have got? You have got middle meatus. See, this is superior meatus, that is middle meatus. Now if you look near the middle meatus, here you have got a structure like this. Right, this structure is called as ethmoid bulla. Okay, what is this structure called as? This particular structure over here, this yellow color structure, whatever I've drawn here, right? So this particular structure is called as ethmoid bulla. Where is this ethmoid bulla located? Ethmoid bulla is located in the middle meatus, or you can tell below the middle turbinate or below the middle concha. Okay, right. Now what I was telling you is that previously I told you this thing, that the frontal sinus, okay, next the maxillary sinus, frontal sinus, maxillary sinus. Next I also told you about anterior ethmoidal sinus. Anterior ethmoidal sinus. So these three sinuses I talked previously: frontal, maxillary and anterior ethmoidal sinus. Now what I am telling you is that, let us say that this particular sinus over here is your frontal sinus, right? In the same way, maxillary, anterior ethmoid sinus also. So what I am telling you is that these sinuses, they directly drain into which meatus here? You see, look at the picture, they are directly draining into which meatus? They are directly draining into the middle meatus. So they drain into your middle meatus. This thing we already talked. This thing we have already discussed. Next important thing is that when I was discussing about the sinuses, that is why I am telling you, watch the paranasal sinus video before you come to this. Okay. So if you look at the sinuses, previously I discussed here, let me show you that picture. See here. In this part, you see these three yellow color boxes, right? See these three yellow color boxes over here. This is called as anterior ethmoid sinus, this is called as middle ethmoid sinus, this is called as posterior ethmoid sinus. You see, anterior and middle are draining into which meatus? They are draining into the middle meatus. Whereas posterior is draining into which meatus? It is draining into the superior nasal meatus. So that was the point which I wanted to make it clear over here, right? So exactly at this important thing, what you need to know is that out of anterior, middle as well as a posterior, let us say this part is the middle. Okay, this part is the middle sphenoid, middle ethmoid sinus. You see, this is your middle ethmoid sinus. Middle ethmoid sinus, if you look here very closely, you see middle ethmoid sinus is draining into where? Middle meatus only. But exactly which point in the middle meatus that it is draining into your ethmoid bulla. Okay. So into the ethmoid bulla, which sinus is draining? Your middle ethmoid sinus. Your middle ethmoid sinus is draining into your ethmoid bulla. Ethmoid bulla. Okay. Next important thing is that here you have got one more sinus. See, exactly this is another sinus. So this particular sinus which I have drawn over here is your sphenoid sinus. What is this? This particular sinus is called as your sphenoid sinus. Okay, this is your sphenoid sinus. Now, where does sphenoid sinus will drain? To look at that, you have to understand what opening is there over here. See, this is your sphenoid sinus. It is draining here. You see the arrow, right? This is how the sphenoid sinus is draining. Actually, where is the sphenoid sinus draining? You know, you have seen the arrow, but you don't know where it is draining. It is draining into the posterior roof of nasal cavity. It is draining into your posterior roof of your nasal cavity. Okay, right. Next, what is the structure that is draining over here through this particular tube over here, right? So through this, you know, this is the opening of eustachian tube. What is this tube? Previously, just now I told you, this is the opening of eustachian tube. But in fact, we did not write it as eustachian tube. We have just written it as pharyngotympanic tube, or we have written it as auditory tube, I think. Right, so this tube over here which you can see is called as a eustachian tube, or you can call it as auditory tube. Auditory tube. Okay, right. So this eustachian tube or auditory tube, right, where does it drain the contents? For example, eustachian tube is attached all the way from the middle ear to the nose. If there is any infection in the middle ear, all this infection will collect within the eustachian tube. If the, let us say, let me draw this picture and make it clear to you. Let us say that this is your external ear. This is your auditory meatus. This is your middle ear. Okay. And here comes your inner ear. What I am trying to tell you is that from the anterior wall, you see a tube like this, right? So this is the tube that is entering into your nose. Okay. For example, if there is any kind of infection, any kind of fluid, in the middle ear there should be air. If there is any kind of fluid, this fluid will drain into the nose and it is cleared off. Okay. So where it is draining, I am asking. It is draining all the way. It is draining all the way into the inferior meatus. It is draining all the way into your inferior meatus. Clear? Right. Next important thing, you see here there is one more drainage tube. There is one more drain here. What is this drain? This is a drain for your nasolacrimal duct. Okay. So your look at the terminology, nasolacrimal duct. Lacrimal gland is this one, right? Nasolacrimal duct is actually present here, right? So this is the duct that is coming all the way and draining into your inferior meatus. So this is the one which drains into your inferior meatus. Okay. So these are some of the very important structures which you need to know regarding the nasal conchae or turbinates, guys. So thank you so much for watching my video. Goodbye.